In yesterday's press release, PAHO Director Dr. Carissa Etienne stated, in the last decade, the Caribbean countries have made significant progress in controlling HIV and AIDS. However, the COVID-19 pandemic is now endangering this hard-won success. We must work harder to move forward along the road to entirely eliminating AIDS, which causes untold human suffering. Welcome to Ask the Expert, World AIDS Day edition. I'm your host for today, Tanya Macfall Major from the Paho, Bahamas and Turks and Caicos Islands country office. We're glad that you've joined us. Please help me in welcoming our guest panel today, Dr. Johan White, Ms. Sandra Jones, and Ms. Adrienne Martin. Dr. Johan White is a family physician and workplace wellness consultant. Johan's career has spanned over academia, industry, and public service. He has partnered with the Caribbean Vulnerable Communities Coalition in several capacities. He received his medical training at the University of the West Indies at the Kingston, Jamaica campus and graduated with honors in medicine and therapeutics and obtained his Doctor of Philosophy degree in disorders of immune systems from Kagoshima University in Japan. Ms. Sandra Jones is the technical advisor for HIV and STI and tuberculosis with the PAHO Subregional Office in Barbados. She started her career in PAHO in 2001 and has worked with Caribbean countries for the past 11 years, providing technical support for the strengthening and expansion of the regional response for HIV, STI, and tuberculosis. Adrienne Martin is a communications advisor to the UN AIDS Caribbean Subregional Office. She is a former journalist from Trinidad and Tobago. Welcome, everyone.
Hi, Tanya. Thanks for having me.
Good to be here.
I'm so happy that you're here with me today. I'm looking forward to a great conversation. Every December 1st, we celebrate World AIDS Day. This day is an opportunity to support those involved in the fight against HIV and to improve understanding of HIV as a global public health problem. This year's World AIDS Day theme is Global Solidarity and Shared Responsibility. Why is this theme important, panelists?
Well, I'll kick it off. It is very much a response to what we've experienced this year with respect to COVID-19. And, over 40 years, almost 40 years of an HIV response, there's certain lessons that we have learned. One of them is that we need global solidarity in order to create a robust response and in order to have a fighting chance against any public health threat that is on this scale. So it means the research scientists working together to come up with solutions, whether it's a cure, whether it's a treatment, whether it's a vaccine, but also having that worldwide commitment to ensuring that all people have access to those public goods, regardless of income level, regardless of which country or region you belong to. So that's the first key lesson. The other dimension of it, shared responsibility, really has to do with how we all have to come together to fight this. HIV and COVID-19, and we're talking here about adapt their health service delivery to meet the need that we have now. We're talking about community organizations. How do they respond to the needs of people on the ground, the lived experiences, the real problems people encounter? And when we talk about the HIV response, how do we adapt to ensure that we don't fall off track, we don't fall off train because of COVID-19? It's by making sure we have all hands on deck. And there is an element of personal responsibility to this. You doing what you need to do to keep yourself safe, but also people reaching out to others, treating others with compassion and care so that we could all get through this together. So the theme, Global Solidarity, Shared Responsibility, covers quite a lot, but it's all about how we're going to manage these twin threats and emerge victorious in the end.
That is very true, Adrienne. And you said something that stood out. You talked about the community, and you talked about we're all having a shared responsibilities. So from the policymakers to the community organization, and even us as individuals, making sure that we do our part to help to curb and eliminate both HIV and AIDS. And that's really important as we look, as we observe this day. Miss Sandra, you wanted to comment?
Right, and I just want to add was that to what was shared by my colleague is that the team is very important, very relevant, because if we are talking about ending AIDS by 2030, to which our
Mhm.
countries and our regions have committed to doing, which we do know the effects of COVID and all this, but we all have a level of responsibility to share at the national level as the regional level.
Mhm.
Uh, as agencies, we have the role to play in providing the technical support to meet the needs of the communities. As civil society organization, join all the regional partners in advocating. Like right now, we're talking about HIV self-testing. How do we advocate for the implementation of innovations that have been proven to be effective in the response? How responsibility of persons who are HIV to understand those innovations, to learn more about their treatment, to adhere to their treatment. So if we are supposed to reach both regional and global commitments and reduce the impact of HIV and now twin with COVID, we all have critical roles to play, and it has to be done in tandem with each other. It's not one or the other. It all has to be done together.
That's very true. And how will this theme impact strategies for HIV going forward, especially given the pandemic? Both of you mentioned the shared responsibilities and particularly during the pandemic in our roles. But what are some of the other impact strategies that we can implement?
Well, one of the things that we've been preaching at UNAIDS and encouraging is that there's a human rights focus to the response to both COVID-19 and to HIV. So ensuring that as we implement strategies, we are mindful of the effect on people's lives. We are
Mhm.
mindful of responding to the impact on their livelihoods, that we implement measures that would ensure that people don't fall through the cracks. So for example, what happens to sex workers who are not able to earn an income during a time like this? What happens to workers in the informal sector? How do we ensure that everybody is able to live, eat, thrive, adhere to their medicines, and get through this without having their rights encroached? So that's a very critical part of it. You know, one of the things we've been hearing throughout this COVID-19 experience is that the Caribbean has been doing really well. Times people have medicine, but not food with which to take it. So we really
Ah,
do
that's a
have
good
to
point.
think about what is the impact on the human being and how are we responding to their needs in a holistic way, not just thinking about the disease response and the public health measures in isolation.
And that's a very good point because, as you mentioned, we don't often think about the connection between the medicine and persons, their economic status, their ability to bring in to feed themselves, as you said, because we can be concerned about getting medicines and self-tests to members of the public. But those persons who may need food, we need to, like you say, have that holistic approach, thinking about all of the participants, all elements involved to ensure that they not only access to food, but they'd be able to progress and to live healthier lives. Dr.
Right.
Johan, you want to interject?
Yes, thank you. If I may just add as well, we know historically HIV/AIDS has shown up certain disparities in societies across populations, where the most vulnerable are the ones who are affected more significantly. And we're seeing that with COVID-19 as well, where racial minorities, ethnic minorities, disenfranchised social groups are the ones that bear the brunt of this condition. And it's similar for HIV/AIDS as it is for COVID-19. I think it's really so critical to engage civil society organizations like the Caribbean Vulnerable Communities Coalition, because they've traditionally filled a gap where health systems have fallen short. And it's going to be important to engage them so that they can be the ears on the ground that can hear what vulnerable communities are saying, what disenfranchised communities are saying, people who are traditionally left on the fringes of society, to hear what their needs are and to be able to meet those needs, because traditionally our health systems have not necessarily been great at capturing those needs. So it's going to be really important to, in a meaningful way, have civil society groups and community representatives involved in decision making and strategizing and planning.
Thank you, Johan. So you made reference to basically the promotion on the engagement rather of the community stakeholders, getting them more involved, not just to hear from them, but making them active participants in ensuring that the needs of the community are being met. And that's something that we should all take into consideration as we move forward. And of course, we want to promote access to medicines through those various channels during the pandemic. But in terms of global solidarity, and do you want to please interject?
No, I just wanted to actually add to what was already shared, is that there are numerous strategies, numerous modalities that have been recommended, but also at the end of the day, and tying it back to the issue of shared responsibility, it is critical for countries to look at the strategies and modalities and to identify how can those be adapted, given realities of the country as well as the health system, because that is also critical. You know, how can the strategies that are recommended be adapted to suit the environment and the needs of the individuals that we're trying to reach, to ensure that we have universal access and coverage, and as we always say at PAHO, to ensure that no one is left behind. So I just wanted to also add that to the discussion as well.
Thank you so much. Global solidarity is needed now more than ever, and as we're in the pandemic. How do you conceptualize the theme of shared responsibilities as it relates to civil society?
Well, civil society has been a game changer, a difference maker in this response, in terms of helping to adapt, to connect people to peer support, adapting to ensure that people have continued access to their treatment. So for example, JASL, Jamaica AIDS Support for Life in Jamaica, pivoting and deciding, you know what, we're going to start dropping off antiretroviral treatment for some of our clients. Or the number of support groups throughout the region who've said, we're going to take our in-person peer support virtual, or we're going to work the phones and make sure we connect with our communities, make sure we know what's going on with everybody, we're keeping in touch, we know if people are adhering, we know what people need. And that has been so critical in this response. And I just want to reiterate what Johan has said, because one of the key recommendations for governments is that if up to this point you have not brought community on board as part of the decision-making process to give you that feedback about what's happening on the ground, then it's critical that you do it now, because COVID is going to be with us for quite some time. And certainly HIV/AIDS is an ongoing response. We need to have that two-way communication. It can't just be top-down. It has to be that their voices, their feedback are integrated into the decision-making process, so we can decide how do we adapt, how do we revise our strategies, so we have the best possible results.
Right. Very good. Thank you so much. We have a question from social media. Hi, Carolina. Carolina asks, what information do you have about countries experiencing working in solidarity in the context of COVID-19?
If I may, one example is that Suriname had an issue with stockouts with respect to their HIV treatment. and were able to have Jamaica and Haiti come to the rescue to lend them some antiretrovirals so that they could sustain their response in the meantime. So we see our countries within the region definitely working together, sharing information and collaborating to make sure no country gets left behind.
And I think that is a characteristic of what we are seeing in the Caribbean, not only during the time of COVID, but also prior to COVID. But we have seen it, of course, at a higher level of rate of that whole technical exchange, or countries helping other countries, because the global shutdown has really affected the availability of ARVs, which are now life-saving drugs, as well as the testing kits and other commodities for HIV STI. And so throughout the region, the Caribbean, we have countries lending to each other. We even have countries from Latin America also supporting the rest of the Caribbean countries. And at PAHO, we have played a very critical role in assessing the levels of stock in these countries and try to actually broker to actually see how best we could have a very comprehensive understanding of what exists so that we can provide countries with the information so that they can support each other. And I think it has worked, because while they have the supply chain management really disrupted in the region, I think this level of solidarity, of Caribbeanism that we have seen and which we are used to in the Caribbean, I think it has really, really helped, and it made a difference for lots of the countries in the region. Yeah.
That's one of the important things about regional collaboration. We're saving lives within the region, and we're able to share the best practices and experiences to improve the existing infrastructure, to make the region a better place.
Yeah. And
if I may just,
the Caribbean has a history. I'm sorry. The Caribbean has a history of doing things together, of work together. And I think that has really, really worked for the region. My apology, Johan.
No, that's okay. I'm sorry. I just wanted to also add that you see it at the level of civil society as well. Regional civil society organizations like Caribbean Vulnerable Communities Coalition and PANCAP actually facilitate the exchange of best practices among civil society groups. And I was so glad when you mentioned JASL as an example, because JASL is as strong and relevant as it is today because of feedback from clients. Clients will tell you the kind and quality of service that they receive, and therefore they keep going back, and it's solving an important need that our health system traditionally has not been able to meet. And it's also easier to innovate as civil society organizations because you're not constricted by all the bureaucracy and the restrictions that it's the Ministry of Health or national government responses usually have to go through. So I think civil society regional fora that allow civil society groups to exchange best practices and talk to each other is really, really, really critical in any response, HIV/AIDS as well as COVID-19.
That is true. Thank you so much. We have a question from Lisa. Hi, Lisa. What are your thoughts on the integration of programs, for instance, STIs and HIV and maternal child health? How would this integration strengthen or weaken HIV programs and testing?
The integration of services are very critical for the strengthening and the expansion of the HIV response at the national level. HIV is not in isolation. A person who is HIV also have chronic health condition, and as we know, have other chronic health condition. And so when you are integrating HIV services, you are providing a people-centered approach to healthcare, and you are linking the individual with critical services such as mental health, chronic illnesses, as I said, sexual and reproductive health. So it ensures that we provide a comprehensive package of service for individual, meeting the entire needs. I think we have moved away from the point of vertical programs. Experiences have showed us that vertical programs are services operating by itself. It just does not work. And so there's a need for the health services, for the health system to integrate these services to particularly at the primary care level, and also to actually link with civil society organizations. We're talking about solidarity, and we know the health system, as we traditionally look at it, cannot do all of this by itself. The services of the civil society organization at the community level is critical to link, to bring people into care and link them to the health services, and hopefully in a services that are integrated, that can meet the entire needs of the individual. I will just use the example of maternal and child health because I think that was raised. The elimination of mother-to-child transmission of HIV and syphilis has to be integrated within the framework of maternal and child health. If that was outside the maternal and child health, we would not have seen the level of success that we are seeing now, in which a number of countries have been validated and others are posed to be validated as eliminating the mother-to-child transmission of HIV and syphilis. And why is the integration so important? It's because the primary prevention and treatment services for HIV and syphilis must happen within the context of antenatal care. Antenatal labor and delivery and postnatal care. So it is very, very critical. It is something that we have been advocating for some time at PAHO, and we continue to advocate for it because we see more than ever, especially now we're looking at COVID, where it's a very, very critical element of the national response. Thanks.
Thank you so much. All right, so we have another question. This question is from Robert. Hi, Robert. Robert is asking, what other priorities or approaches on HIV education and testing at this time? Johan, would you like to take that one?
Sure, I'll start. I think it's going to be important to continue to reinforce HIV prevention messages, especially for youth, because you have upcoming generations that may not be accessing the message, or because of restrictions in educational institutions, the message is not fully available to our youth. And so we, as a response, cannot become complacent, because we did a campaign or educational effort a year ago or 2 years ago. It has to be consistent because you have youth, you have young people who are coming up out of educational institutions that unfortunately still to this day restrict the kind of messaging that can be passed on to our youth. And our youth are particularly vulnerable, especially in some of our societies in the Caribbean, because there are unfortunate gender norms that are still in existence, and you have adolescent girls that are particularly vulnerable because of those gender norms that exist in our society, where they're preyed on by mature men. So those realities still exist, and I think the message has to be, we have to ensure that we don't stop sending the message, and we have to tailor it to our most vulnerable persons. Youth need specific kinds of messages, and to be able to do that, you have to involve youth in coining messages. Earlier, one of our panelists mentioned about vertical systems and the top-down approach. And with youth, you really do have to involve them in coining the message, because they understand their own language that we, I still consider myself youth, as I do all the panelists here. But it's really going to be important. You can see it in primary care, you can see it in the delivery of HIV prevention and treatment services where that particular group youth don't do very well in terms of their outcomes, in terms of their adherence with antiretroviral treatments. And that's because there's still significant gaps in how we cater to their needs. So I think that would be probably my number one priority, focusing on youth and ensuring that there's prevention messaging that's reaching them and that our health system is involving them in coining the messaging and coining our response to youth.
And I was going, oh, go ahead. I'll go after you.
I was going to say, I was so glad that Robert raised the point, because that is a critical area of concern for the Caribbean.
Yes.
A few things are happening. People don't want to go to a clinic if they don't absolutely have to. You know that there's some COVID thing going on out there. So, and we're being told, limit your movement, don't go out.
Yeah.
The community organizations maybe are not as testing has fallen off as well. So how do we make sure that we keep on track with respect to HIV diagnosis, which is so important? Because our whole goal is to get 90% of people living with HIV in the Caribbean diagnosed by the end of this year. That is the target we were going for. At the end of 2019, we had only reached 77%. So we were already behind before COVID-19. One of the strategies that we've come up with to hopefully close that gap is to advocate for Caribbean governments to implement HIV self-testing. And yesterday, we launched the In Your Hands campaign. This is a collaboration with UNAIDS Caribbean, PAHO, PEPFAR, PANCAP, Caribbean MedLabs Foundation, several community leaders, and of course, we welcome all members of Caribbean civil society involved in the AIDS response to come on board, to join voices and come together and demand that we implement an HIV self-testing strategy, because it means we're not only relying on our facilities, we're not only relying on our community organizations, we can now put a tool in people's hands for them to learn their HIV status. And with the correct framework of communication, of education, sensitization, people will then have the information they need to be linked to care, to confirm a result if necessary, to get prevention services if necessary, and to enter into treatment.
And if I could also, sorry, I thought I was muted there for a while. And if I could also add to what Cedron is saying, and this is the focus of the World AIDS Day campaign for the Caribbean. Strategies, what testing strategy that can we implement to advance the HIV response, for people to know their status and to bring people into care, linking them into care. And we do know that one of the strategies that we are promoting now is the whole strategy of the HIV self-testing, as what was just mentioned by Cedron. The HIV self-testing, it has proven to be very accurate. And for countries that have utilized it, it is acceptable because it provides the individual with the opportunity to be tested within the comfort of their own environment and their own space. But it's not just about just you testing in your own space, but how can we integrate, and this is where we look at the whole integration again, integrate HIV self-testing as one of the strategies that for countries to actually include. So it's not by itself, but it should be offered as an approach to testing services. And this is where, of course, the community civil society organization have a very critical role to play and to work very closely with the health services, because it's not only getting tested, but how do you link individual into care? What are the different modalities that countries will establish and put into place to ensure that testing, those who are tested, utilizing the self-test tool will link into care. How are they going to be referred? How are they going to be followed up? And WHO has put out a number of different recommendations and tools that can be adapted to be utilized by countries. And I keep saying it's not just having the recommendation, but looking at these recommendations to determine how best they can be adapted based on the realities of the health system and of the country.
Thank you so much. This is a lot of great information. And as you can see, our listeners, our audience on both Twitter and our Facebook pages, they're really learning. And so they appreciate that as well. We have a question from Lisa B. And it says, is the self-test intended to reduce the need for persons to rely on health services for HIV testing? And do we think that this will be a game changer to help people, more persons, know their status?
It is not supposed to replace individuals testing in the health facility. Those who are tested using the HIV self-test, you are tested, but you have to be linked to the healthcare system so that you could be tested for that result to be confirmed, and you are tested based on the national algorithm. And based on the result, you are linked into care to ensure that you get the appropriate treatment and services based on the national guidelines of the country. And if you're negative, you want to link into services to ensure that you continue to be HIV negative. So absolutely, it is not there to replace the existing HIV testing strategies, but it should be integrated and be one option for individual to use. And the advantage is that people who normally would not go into the health system to get a test would be able to access the test.
Tanya, one of the great things about the HIV response at this point is that we have all these different tools. So whereas at the start of it, you would have to go to a facility, and I remember the days when you would have to take a blood sample in a vial and come back in 3 weeks. I remember those days. That was not so long ago. And then we got rapid tests where you could get your result in 10 minutes. Right. And now we have the option of saying you can do this in the privacy of your home, in your bathroom, in your bedroom, in your kitchen. So it's just another tool in our toolkit that we could use to complement everything that we already have going.
That is true. And as you talk, but something that came to mind, one of the panelists mentioned earlier that we tend not to go to the healthcare clinics, particularly in a report it said that Caribbean men in particular, they were less likely to go to the healthcare clinics, especially when it comes to wanting to take a HIV or AIDS testing. And as is mentioned by our panelists, this is more free. It empowers persons now to go and to take their test, whether you want to take it in your bathroom at home or wherever you are, wherever you're comfortable, and whenever you need that testing, whenever you need to know, you can get the information that you need. But I do have a question in terms of the self-test. Is there a period, a certain window that you would need to maybe take a test now, and then in between that time, if it is that you're engaged in sexual activity, would you need to take it like every month, every 2 months? Is there a set time, or just whenever you think you need to take the test, you just take it?
Right. That's an important question. The benefit of self-testing is that it also facilitates habitual testing. So even if persons will be willing to go to a health facility once per year, it's really not enough, because once you're sexually active, your risk continues, your risk is there. Most of the self-test kits are looking for antibodies to the HIV virus. So antibodies are what are made, substances that are made by your body to try to fight HIV. And it takes time for your body to be able to make these substances. So typically maybe 1 to 3 months, for example, in that range. And so when you're doing a self-test, if you get a negative test, meaning it doesn't detect any antibodies to HIV at that particular point in time, it does not necessarily mean that there's no HIV infection on board. What it means is that it's showing that you don't have antibodies to the virus. And so to be sure, it will be important to test habitually. So if you are exposed, then if your body is in the process of making antibodies, then about 3 months later, it would be good to repeat that test because you will be able to, by that time, be able to confirm whether there are antibodies in your system. And so self-testing is really a good tool to foster habitual testing because you want, depending on your risk level or your exposure, 2 to 3 times or more tests per year is what is recommended, even 4 times per year for certain groups. So there is what we refer to as a window period. It's that period where even if infection is on board, there's a possibility of a self-test or an antibody-based test missing it because your body has not yet manufactured or made those antibodies for the test to be able to pick up.
Thank you. Go ahead.
And also, I think what we also need to actually look at that HIV self-testing is not a strategy that is being promoted in isolation. As I said, it is one of the strategies that should be included in national testing strategy, but also as part of the HIV prevention combination approach. So it is just one of the tools within that toolbox, to use Cedrian's words. So, and this is where the integration actually comes in. So we also, within that context, if someone is negative, and that person is of high risk, what you want to do is to link the individual into services so that at least the next 12 months you will be able to assess that person, because the idea is those who test negative, you want them to remain negative, So so those are some of the things that needs to be contemplated, and this is why I keep saying we have to look at the reality, the epidemiology of the country, the health system, and the realities, and then we modify and implement those strategies based on what exists.
Thank you so much. So we have another question from social media. This question is from Angela. Hi, Angela. If self-testing is done, do you envision more people accessing the healthcare that they need? Panel?
Yes, because as rightly said earlier, HIV self-test is not a diagnosis in itself. Right. It is important for individuals to link into the healthcare service with the so that result can actually be confirmed and confirmed based on the national algorithm. So yes, we will see more people accessing the health services. And if they're positive, we're going to see more people hopefully link into care, because the idea, you want to link individuals into care early so that we do not lose individuals. And as I said earlier, you want them to link into services to ensure that they are negative. So yes, we should see an uptake.
Oh, she's back.
Oh, okay. So I don't know where I was lost. So, but anyway, what I'm going to say, at the end of the day, we should be seeing more individuals link into care to actually to confirm their tests, their self-test result based on the national algorithm. They are linked into care, and at the same time, we should be able to actually see them access the wide range of services within that whole combination approach. And if we're talking about self-testing as a tool to reach those people who would never get tested or do not come into the health system for a health test, I think also we should expect to see an increase.
And if I may also add that because of how simple the self-test is, it can be administered at a greater variety of health facilities or health associated facilities. And it can be individual self-testing, or it can be assisted self-testing. So you can imagine something like an oral test in a pharmacy or in a civil society organization. If you're talking about time requirements, for example, in a pharmacy, the pharmacist doesn't have to be sitting there with you necessarily with a finger prick for a rapid test and having to wait 15 minutes or so. You can be counseled briefly, or be given IEC materials or information, and then you can go to the bathroom, you swab yourself, you're instructed after 10 minutes, etc. And the pharmacist can provide information about what to do next in terms of being linked to a health facility. So if you're negative, the aim is to, as Sandra said earlier, is to keep you negative. And if you're positive, is to ensure that you are linked to care in a timely manner, because early treatment has an important impact on your outcome, and not just waiting to be placed on treatment, but immediate linkage to care. So a greater number of access points can be facilitated because of the simplicity of self-testing. So we do expect that to translate into into greater access to self-testing and greater use.
Tanya, yesterday at the launch, we had a couple Caribbean leaders in the HIV response. One of them was Yaita Val, and I had to pull up the name of her organization. It is the Community Action for the Integration of Vulnerable Women in Haiti.
Okay.
Right. And it serves transgender people in Haiti. They just opened their very first safe house for transgender people. And she reported that accessing an HIV test, something that people might take for granted, is so challenging when you're in a transgender person in that context. And I'm sure, we could recognize similar challenges throughout the region.
Yeah.
And she was saying it would be so valuable for them at the safe house if this is something they could have there on site to provide to their class, as Johan said, not just for the individual use, but for use by community organizations. And very critically, having the support of community to help guide people and link them into care, which is absolutely essential.
That's very good. And congratulations to Val, was her name? You're muted.
Yaisa Val, and she is incredible. I am over the moon about her story. Go to unaids.org and look her up. Her life story is there. Really, really fantastic.
That's very encouraging. And as we said, if we can have more community organizations with the HIV self-test, have them available to their members, that is a great advantage for all of us. And even if it can be available, as was mentioned, in the pharmacies, grab your vitamins, grab your self-test, or grab your contraceptives, grab your self-test, and you can go and you can take your power, get the knowledge that you need. And I know another important part of it would be in terms of having monitoring and linking to services. If virtual opportunities are available, maybe to provide more guidance and to share information, educating the general public of what to do. Maybe if you find out that your test is positive, here are the steps that you can take, and we link you to those services. And those parts are really important. So we have another question. Oh, go ahead.
I just wanted to zone in on the point that you made, Tanya, because it's not only having the HIV self-test available, but the mechanisms that are in place to support an individual taking the test. Because if a person goes to the pharmacist to procure it, you want to ensure, because people procure these things online all over the place now, but you want to ensure that the proper information is there as how to access, how to take the test, and what to do, because you don't want someone to take a test at home, get a positive result, and then what? So these are mechanisms that has to be carefully thought out and implemented at the national level and disseminated so people will have that information. And so going attached to that is information, education materials, which needs to be socialized at the country level, as well as people also can decide information. Do you want to take this at home by yourself, or in your own private space, or within the health facilities? So these are some of the issues that we have to address as we go forward.
Thank you. And we have a comment from our Facebook page from Alexis DeMarco. Alexis DeMarco is stating, hi Alexis. Alexis is stating that supporting key populations through NGOs with self-testing is a great way forward, and linking to care and after self-testing can help. And we know that's important for all members of society. So another thing that we can understand and we can appreciate is because persons have the opportunity to get the information that they need, they don't have to face anymore. They won't have to worry about facing any stigmas or discrimination of any sort. They then can take do their test, get the information that they need, and then follow the links to the various credible help that they need, whether it's their healthcare centers. And of course, you can always visit both the UNAIDS and PAHO's websites and our Facebook, Twitter pages for more information regarding not only HIV and AIDS and self-test, but basically every topic that you need in regards to health. We have another question. We kind of touched it already. What are some innovations that can be promoted during COVID-19 to support HIV services? We talked about, go ahead.
Yes, Tanya, some of the adjustments that have been made, you know, it's because of COVID-19, people are thinking on their feet, they're being flexible, they're being agile, and they're deciding, okay, this is what we could do to connect to people virtually. We can maybe use telemedicine to communicate with a client to determine whether they need additional care or whether this is something that can be talked through over the phone. So people are coming up with all different strategies to ensure that we stay in touch and that people still have access to healthcare. And I had mentioned before the community organizations that are going above and beyond to drop off people's medicine and to keep in contact. Another example in Guyana, the HIV Food Bank, they've expanded their reach to include members of key population communities who are not living with HIV, but who need access to nutrition support. So all through the region, people are thinking on their feet and saying, okay, how can we do things a bit differently to meet a clear and present need? But one of the points I want to make here is that some of these actions are not innovations per se. They are things that we have known are best practices for quite some time. And COVID-19 is creating the opportunity or even the pressure to finally implement, finally get it done. Multi-month dispensing, making sure people, a stable client has access to at least 3 months medication so they don't have to keep coming to the clinic. That is something that many countries have adopted as a policy for a long time, but hadn't necessarily been implementing. And now in COVID-19, here's your opportunity to implement.
So we've moved now to enforcement of what we've already known and being held accountable for the things that we should have been putting into practice. So that's been some good.
Yeah, so we countries have just scaled up these things that they have started on a smaller scale. They are enforced. And right now, looking at the whole issue of HIV self-testing, because self-testing is now being discussed more than ever because of COVID. COVID has allowed for it to be as a priority on the regional and national agenda at this time.
That's very good. And even piggybacking on that, we have another question. What are some of the efforts to advance HIV self-testing in the region? What are some of the efforts to advance HIV self-testing in the region?
Over the years, PAHO, in collaboration with other partners, we have been advocating in different spaces for the advancement of the HIV self-testing, and including webinars. But we have seen now where more countries are advancing towards they have draft policies, so they are thinking about this. And also there is an effort now, which is spearheaded by the Caribbean Med Labs Foundation in collaboration with PAHO and PANCAP to actually look at the verification and the feasibility of implementing HIV self-testing in selected countries as well, selective countries as well. We have the 6 Eastern Caribbean states also that are part of this project, in which they will implement it and at the health facility as well as at the community level to actually see if it's going to work, how it's work, and for it to be recommended as part of a strategy for countries.
Thank you so much.
If I may just quickly add that when organizations like PAHO are able to lead this initiative, it is most welcome because you have the capacity to evaluate the evidence and to say that this is what can be expected from self-testing. But when that is done, I think civil society has a unique role to play in terms of advocacy, because national governments sometimes lag, maybe because of the political environment, or because of social issues or other concerns or questions or confidence in the mechanisms, etc. The evidence may be strong, but the adaptation or the adopting of it may not be there. And that's where civil society plays a critical role in informing their base and in working with national governments and ministries of health to make sure that evidence-based interventions such as self-testing, and the same is true for interventions like PrEP, pre-exposure prophylaxis, the uptake of which lagged for the Caribbean significantly. So civil society plays an important role in agitating for these tools, because we do have a lot of work to do despite the achievements in the HIV response.
Thank you.
And I want to add to that an advocacy role for sure. Yes. And we are asking people to come on board to help us generate demand for HIV self-testing, but also a role in terms of being a watchdog, in terms of being a reality check and letting us know what some of the pitfalls might be and ensuring that we work together to address them. Some of the messages that we heard very clearly from civil society was that we need to do a better job in the Caribbean with respect to counseling, post-test counseling, and with respect to adherence counseling. So whether you get your HIV test from a community organization, from a clinic, or at home, what happens next? How can we strengthen our response to make sure people are truly supported, not just in a one-off session, but as possible results? So we need civil society accountable to make sure self-testing is executed properly.
Thank you. So as we prepare to wrap up, we know that with the HIV self-test, and Dr. Johan, you can talk about it briefly if you want. We know that it's a simple process where you're taking either your blood sample or oral fluid and you insert it into this test. And it takes about 20 minutes?
Yes, it varies. So the kits will specify the time, but usually between 10 to 20 minutes.
Is there anything that persons need to bear in mind when taking the test, or anything they should look for?
Yes, briefly, I would say that you want to ensure that it's a reliable kit, so you get it from a reputable source. You want to check that it has instructions for use, because unfortunately there's some outlets that will just have the kits available. There's no instruction for how to use it, as Sandra mentioned earlier, as well as what to do if the test is negative or if it's positive, linkage information to a facility in your country. But you want to do practical things as well, like following the instructions as they're listed in the packet. So if it says read the result at 20 minutes, you don't try to read the results at 40 minutes or an hour, because beyond the time that the kit specifies, then the test is it will behave differently and it's not a real result. And other things like checking the integrity of the package. Has it been tampered with? Is it torn? You have to make sure that it's not expired. So those practical things will be very important.
Okay, thank you. And our last and final question, as we have a few seconds, how can we mitigate against unforeseen challenges in regards to the self-test?
I could just comment briefly just before Cedric and Sandra, which is just to say, you're going to hand somebody a kit. You want to do a risk assessment. Do you think your environment where you're going to be tested is safe? Are you being coerced or pressured to do this self-testing? It's really important to ask, is a partner telling you, you better go get that test or else, right? So it's important to take a moment as healthcare providers to do that assessment and then to work with the client to find a solution that works for their situation.
It's very true.
Yeah, and I would want to add, within the process, you want to provide the individual with the information about the test and underscoring that it is not a definitive result. That follow-up test is actually needed, and ensure that the individual has all the information through providing some kind of pre-test information before they set out to actually take the test, and discuss some of the issues based on the person's risk. Those things are relevant. So it's not just giving a test, but just have a discussion, pre-test information, and contextualize and discuss the way forward with the individual before the test is done.
Thank you. All right, so Ms. Sandra Jones, Dr. Johan White, and Ms. Cedrienne Martin, I thank you for this provocative and informative conversation today. And to all of our persons who are participating via social media, thank you for being a part of our discussion today. And we just have 2 quick words. If you do have HIV, find a healthcare provider to talk to. And if you don't have HIV, you can't stay that way. Have a great day, everyone. Feel free to always to check out our social media pages or our website at paho.org.
Excellent, thank you.